Now, many people associate lasers with sci-fi movies. However, in the healthcare world, we use something called low-level laser therapy, and it's a powerful tool that can help reduce pain, speed up recovery, and promote overall well-being.
That's right. And in this video, we're going to discuss and explain what this therapy is with the laser and what diagnoses it can be treated, as well as how Bob is using it to treat his diagnosis. Hi, I'm Brad.
I'm Mike, and behind the scenes we have Bob, and together we're the most famous physical therapy team on the internet.
Naturally, in our opinion, of course, Mike.
Now, low-level laser therapy has been around for many years, but Bob, Brad, and myself personally don't have a lot of experience with it until recently. As we all know, Bob was diagnosed with ataxia, and he has been using this laser therapy treatment to help him walk better.
So what we did is we actually are going to talk to the doctor on how it works with Bob. His name is Dr. Trevor Berry. He is an expert and uses this on a regular basis. He's board certified chiropractic neurologist. He has over 3,000 hours of postdoctoral studies in this field, and he's also involved in multiple laser studies.
Now, many people asked us from the last video, what is this device? It's low-level laser therapy, but the brand is Erconia, so you can find this at erconia.com, or you can find the link down below. Now we're going to get into some explanation from Dr. Berry explaining exactly what what low-level laser therapy is, how it's used, what it can be treated. It's a bit lengthy, but stick around because there's some good information.
There you go. It goes into detail and very interesting.
I got in at 3 a.m., so I warned you guys. So low-level laser, it's basically taking light energy and harnessing it for the utilization of cellular function. So as humans, we're kind of indoctrinated in Western medicine to be thought of as chemical-based, but we're actually energy-based models. And so laser takes the photonic energy of light, and we use that to create all kinds of healing processes, energy, all kinds of physiological effects that we'll get into. So I kind of like, when I talk about low-level laser therapy, I kind of liken it to photosynthesis. Most people study plants and how sunlight is necessary for their health and well-being and survival. And so we are energy beings as well. So we can tap into that using light energy to optimize our physiology.
Does it help mitochondria?
That's one of the mitochondrial benefits are probably one of the most profound things about laser energy, because not to get too technical on the electron transport chain, but if you look at the enzymes that are on the wall of the mitochondria that initiate the whole Krebs cycle and what's called oxidative phosphorylation, that's just a technical term for making our body's fuel supply. It's called ATP. Well, lasers have been shown to upregulate those enzymes, and we're even seeing more specificity to the more colors that we introduce with laser, the more efficient we are at upregulating those systems. So lasers are one of your best ways to improve mitochondrial output, energy, ATP synthesis. But not only that, lasers have been shown to create mitochondrial biogenesis. So even making new mitochondria, for whether it's free floating in your bloodstream or in the most metabolically active tissues, that makes a big difference, right? Because you look at areas that need the most energy, like the brain, like the liver and whatnot, the lasers actually will promote new formation of mitochondria, let alone increase their output. Low-level laser therapy works on a lot of different levels. One of them, like we just alluded to with the energy output and the mitochondrial function, laser has a very profound anti-inflammatory effect. That's a huge component of laser, because if you look at a lot of the medical conditions that we're suffering from, whether it's in an orthopedic realm, in a neurological realm, autoimmunity is a big thing that we're dealing with. Yeah, all these things that you hear about, like why we take certain, or some people would take like an over-the-counter pain medication for like a COX-2 or prostaglandin inhibition. Lasers will actually act the same way by
Curcumin.
Curcumin has a very good anti-inflammatory effect. The linchpin of inflammation is a technical term. It's called nuclear factor kappa beta, or NFKB. And pretty much all the other inflammation cascade stems from that, whether it's the interleukins, the COXs, the interleukin 6, interleukin 1b. You'll hear it in the literature, it's called the inflammation soup. Right. And we need inflammation. We want inflammation, but we just don't want it to be a chronic inflammatory thing. And if you look at some of the leading causes of death in this country, just as an example, almost all of them have an inflammation underpinning.
Yeah,
so if you can tamp down inflammation, you have a game changer for health in this country. And lasers have been shown to cut off or downregulate inflammation at every step and every cascade of inflammation.
Even Alzheimer's. Right.
That's a huge one. Well, and it's for those that are worried from an Alzheimer's perspective that maybe have a genetic predilection. You hear these terms like ApoE4 and TREM2 and all these. It's just we all have these genetic SNPs that kind of make us vulnerable to certain conditions. Well, the biggest thing that will push somebody off the cliff, so to speak, for Alzheimer's if they're genetically predisposed is brain inflammation. If you look at Tanzi's work out of Harvard, for example, that's the number one, what they call epigenetic tripwire to push you into actually that gene SNP expressing is brain inflammation. So this is one of the big areas that I'm interested most in neurodegenerative conditions is using laser transcranially and in the body systemically to tamp down inflammation. So just lasers from an energy model and an inflammation model, just those two things right there, we could almost, that could end that discussion. But lasers have been shown to promote all the antioxidant systems, all the growth factors needed for brain and body repair. And they actually have been shown to promote neurogenesis, which is like the holy grail of brain rehab. If you can make new neurons because once a neuron goes bye-bye, it's called apoptosis. Once a neuron's dead, it's dead. It doesn't turn over like your liver cells and things like that. So we look for stem cells and, things of that nature. What can we do to get new neurons in the brain tissue? Well, lasers have actually been shown to do that in areas like the hippocampus, where memory is, and that's where dementia starts. So it checks off a lot of boxes that you need for brain and body health. So low-level lasers can treat. Yes.
My wife has osteoarthritis.
Of which
hand, knees, and hips.
Okay, so there's a good example of, when you look at all the arthritides, including osteoarthritis, and when you see more systemic osteoarthritis, you start to look at terms like what can cause systemic inflammation and what can attack the chondrocytes, if you will. Well, one of the big issues in this country is leptin resistance, with obesity and fat tissue and stuff. And it's almost like diabetes in a way. When you start to develop leptin resistance, the leptin actually, your adipose keeps telling you it sends out leptin to tell you, hey, you're full. You don't have to eat anymore, kind of thing. But then as we develop leptin resistance, what happens is the circulating leptins that your fat tissue is trying to tell your brain to stop eating keeps circulating and it binds to the joint cartilage. And then you develop systemic osteoarthritic types of conditions. So, and what's interesting is chondrocytes actually have an affinity. There's certain mitochondrial complexes that we alluded to. And it turns out that green and violet wavelengths do even better for chondrocytes than just red. And that's not saying red doesn't have a very beneficial effect on osteoarthritis and other arthritides, but as we add green and violet, we're getting even better outcomes with that. So pretty much every musculoskeletal condition has research and clinical showing that lasers can be beneficial, whether it's carpal tunnel syndrome, chronic pain, acute pain, all your dermatological stuff, wound healing, anything that has an orthopedic underpinning to it, like TMJ, and the list just goes on and on. So, like from a physical therapy standpoint and sports medicine,
I remember wound healing was a big one.
Yes, yeah, absolutely, yeah. And then even sports performance. You know, I always, when I speak, one of the articles I bring up is there's actually a research paper that said they were considering banning laser from international competition because it gave the athletes such a performance benefit. But how are you going to ban light? You know, that to me, that was always an interesting concept that you can't ban light. Like, I'm not going to go into the sun either. Right? So, but you know, my area of interest again is obviously from all the orthopedic. You'll hear most of the studies, for example, that we talk about today are like pain management and other orthopedic type scenarios. But from the neurological standpoint, when people ask me, well, when I'm working and supporting Parkinson's and Alzheimer's and ataxias and things like that, what's the number one tool I can use in my integrative neurology practice? Without hesitation, I say low-level laser therapy. Yeah. But we're seeing it being used in functional medicine realms. Like there's evidence with thyroid dysfunction and other like organ-based things, autoimmune regulation and all the autoimmune conditions. Yeah. So really, when you start looking, there's over 16,000 papers on low-level laser that are published, on PubMed and places like that. It never ceases to amaze me. Every time somebody asks me, well, if lasers has been shown to work with this XYZ condition, sometimes I'll be like, there's no way. And then I look it up and sure enough, there's the evidence. So I would say to the audience, just when in doubt, look up a PubMed or Google Scholar and see if there's laser evidence for it. And there's a high probability that there is some. Low-level laser therapy safety is one of the most impressive things to me. And when I've done, I've been a principal investigator in research, and it's something that obviously our number one job as physicians is do no harm. Right. And when you have low-level laser therapy, like for example with Erconia, of the 22 FDA clearances that they have, which is more than all other light companies combined, there's 26 FDA clearances and they have 22 of them. There has never been a reported adverse event with their studies ever. I mean, who can make that claim? Not too many, medical or therapeutic devices can make that claim. So the big difference, and we'll expand on this morning, but is the idea that low-level laser, there's that element of laser, and then there's the higher powered lasers. And that's where you have to separate those two worlds, because when you start getting more higher powered laser, absolutely there can be side effects and deleterious effects and things like that. But non-thermal photochemical low-level laser like Erconia is, it's about as safe as you're going to get in healthcare. So the side effects of low-level laser therapy, that you might feel too good, that you can, no, it's the interesting thing again about low-level laser therapy is that the splitting the difference between that and the higher power. One of the things with the FDA contraindications of low-level laser, you're going to hear terms, or the conditions. You're not supposed to use laser on retina, pregnancy, cancer, and then they'll mention things like pacemakers and titanium hips and stuff. But the interesting thing to understand about the FDA contraindications is they put all light devices under the same umbrella. So again, there's a huge difference between class 2 lasers and class 4 lasers and the safety. I actually do retinal things. This is Trevor Berry talking, as far as doing certain things with the eyes, for example. I have no issues working with, patients that have some of these things that would typically be contraindicated because this device is so safe. When you do non-thermal stuff and you don't exceed what's called hormetic threshold or dose, this is a little bit technical, but there's a term that I always want my audiences to hear, and that's not exceeding 10 joules per centimeter squared. I know that sounds Greek, but the take-home point is that more power is not necessarily better, because you'll hear that rhetoric in the light industry that our low-level laser is great. It has all this research behind it, so our laser is more powerful, so it'll work faster and it's deeper penetrating. You'll hear terms like that, and that's not what the science supports. So there's a Goldilocks effect that you want to stay in laser power and dose, and as long as you're in that sweet spot, you're going to get all the benefits of light therapy without any of the contraindications. Sessions can be it's pretty quick, relatively speaking. One of the things I like about it is it doesn't slow up the practice at all. Like I'll stack low-level laser therapy with my other modalities, or I'll use it as a standalone. The most I will do with a patient on low-level laser therapy is 20 minutes. That's the most, and that was on a chronic low back. scenario kind of thing. But most of the device, like when I use laser, it's maybe 10-minute treatment. But sometimes it's even less than that. So lasers actually can work pretty quick, and laser therapy, there's very few conditions that you would have to go more than 20 minutes. And because of like, you've got your stand, there's a couple different devices, whether it's on a stand or it's a built-in stand, you can set it and forget it, so it doesn't like a lot of my staff does a lot of my laser applications because they're trained, okay, do the, chronic pain setting on the left SI joint or something. And the staff goes in while I'm on to my next patient. Results from laser therapy, I'm actually looking for immediate changes. I like to see changes right out of the gate. Say they come in for an orthopedic condition like range of motion loss. I'll actually do laser without even touching the patient a lot of times in that setting, and then maybe recheck their goniometer or inclinometer, and just without even touching, without doing any of the chiropractic or physical therapy, none of that stuff. And they just pre and post check their range of motion and seeing differences right away. Or
retest.
Yeah, exactly. And that's a big thing. Whatever it is that you're doing or having, testing as a healthcare provider or getting tested, I always have my docs that are integrating laser to say, okay, say you do a strength test and it's weak in the bicep. I'll do things with the laser, like laser the bicep and see if it gets stronger. I'll laser the nerve root, spinal cord area, see if it gets stronger. I'll laser the cerebellum, see if it gets stronger. I'll laser the parietal frontal integration. And so I actually use lasers as a pseudo diagnostic tool. Well, because when I get that energy into the nervous system and those different parts of the body, and that's actually what makes that system stronger or the better sensory or whatever, that actually gives me clinical judgment to say, oh, you know what, I'm going to do more cerebellar based rehab with this patient or more frontal lobe based. So in lasers are very, it's something that I want to see fairly immediate changes, but with all the more complex the condition, the more I'll give myself a treatment strategy, or what I call a treatment trial. For base musculoskeletal stuff, I'm typically going to tell a patient, hey, give me 6 visits with this and see what I can do with it. For the more complex, say it's like a complex regional pain syndrome or some of these complex neurological things, I do a 12-visit treatment trial just again as a proof of concept. But along the way, I'm looking for fairly immediate changes. I love that question of if low-level laser therapy can be used in conjunction, because I think that's one of the most profound things about lasers. Whatever you're doing in practice, you can just stack that laser on top of that. So whether it's a physical therapy modality, like an electrical device, whether it's like a range of motion, or say you're doing some sort of stretching technique or something along those lines, just stack the laser over top of it, because it makes anything you're doing in practice that much more effective and that much more efficient. And one of the other things I like as a practitioner, and you're in the same boat, when we're working, it takes a toll on our body. So if we can offset some of that, lasers save my hands and wrists from a lot of the manual therapies. That's actually what got me into it in the first place. And so I always tell docs, you can use it as a standalone to set it and forget it, like we mentioned. But if whatever your techniques, whatever you're doing in practice, whatever, ART or, PNF stretching or whatever, stack lasers with it and you'll get even better and more effective and efficient outcomes from that. Chronic pain and low-level laser. Well, again, this one's kind of near and dear to me because one of the studies I was the principal investigator was the chronic back pain studies. So yes, I can emphatically say firsthand that lasers are one of the most effective tools for chronic pain. And this is such an important thing because there's a funeral last week for unfortunately one of my patients. Kid got addicted to opiates, and that opiate epidemic is so rampant still, in the fentanyl crisis and everything. Healthcare providers are looking for alternatives to prescribed medicines like the opiates. And so one of the I'll have a lot of medical doctors refer to me for that reason, because they want a safe, effective, proven alternative.
I hear that often.
Oh, it's
yeah.
they're that's something that everyone's looking for, safer and effective, proven ways to treat chronic pain. And so, yes, lasers have been, like Erconia has chronic pain studies, back pain, neck pain, shoulder pain. They actually have full musculoskeletal pain clearance for FDA because, again, with their FDA clearances, these are double-blind, randomized, placebo-controlled studies. So they're multi-site. I don't know what they're getting. They don't know what they're getting. So it's it's a very strict study. And so they've demonstrated not only is it effective for chronic pain and acute pain, but also that it's safe. And so that's why they have full musculoskeletal clearance for their devices. Low-level laser therapy is typically, you don't need a prescription for it. As a matter of fact, the different kinds of healthcare providers. So whatever your specialty is, whether it's physical therapy, OT, chiropractic, whatever it is, you can use low-level laser therapy. Now, a lot of patients will buy one, and that's becoming a big thing that you'll see. And a lot of patients, when they get the effectiveness of laser, they'll actually buy their own. And that in that setting, I'll give them a prescription for it. But it is safe. And like Erconia, for example, has over-the-counter clearance on some of their devices as well, too. So now, again, I have to kind of separate because when you're using the higher power devices, you need to be in a closed room. All the people in the room need to be wearing protective eyewear, things like that. I am not going to send a device like that home with a patient. That's just not something that would be responsible as a healthcare provider. But with Erconia, I do a rental program where patients will rent out a device, and I can do that and without hesitation or reservation. Or like I said, they can buy a laser too. So it kind of shows you how safe they are and the game. But that's using a class 2 photochemical laser, not a higher powered thermal laser. So I like the idea of doing maintenance on laser therapy. A couple of reasons why. Now, lasers, interestingly, they actually have a cumulative effect. So, like, for example, when we did the chronic pain study, we did 2 times a week for 4 weeks, but then we continued to follow the patient along at 8 weeks, at 16, and we did year follow-up. And true laser has a cumulative effect. So it actually builds up in the system, so to speak, in simple terms, and you'll see long-term benefits. Now, conversely, we use LED as our sham placebo when we do these double-blind studies, because a lot of people see, if there's a red light and a red light, they just assume it's the laser. But LED is a whole different animal. That's just scattered photons, and so we use that as our sham or placebo. Now, what you'll see with the LED studies is that during the course of the treatment, you may see a small change of benefit on like their pain scales and Oswestry index and stuff, but they end up going back to baseline. Whereas a year later, the laser patients are still improved. Now, for brain benefits and stuff, I would absolutely say yes, do maintenance stuff with that. It's like, it's interesting to me on how we'll go to a dentist twice a year or whatever for our teeth, and yet people aren't doing brain-based applications as a maintenance thing. And I'm always telling patients, you can replace your teeth, you can't replace your brain, kind of thing, right? So, I have patients that maybe flew in to see me for an intensive, and when they're in Phoenix where I'm practicing and they're just in town for a day or something, what do you think they're doing? They're coming into my office for a maintenance visit where we tune up their brain, we do lasers on them and that kind of thing. So yeah, I think it's a good idea. Just like we do other things in our body for maintenance, lasers should be an integral part of our maintenance program for brain and body health.
I stopped for 3 days and I got much worse.
Yeah, and so to your point, in these complex conditions like the cerebellar ataxias and whatnot, those are the kind of things where, again, that's where a lot of those patients, as you did, you get your own device so that, you can do. I laser myself every day in practice. Oh yeah, that's how I spend my lunch. I actually send her a laser.
I do 7 days a week.
Absolutely, yeah. And I notice a huge difference too on my clarity, my cognition. When I sit at lunch, I'll sit under the laser and meditate, and it resets me. It just gets me focused for the afternoon. It's a great way to kind of break up my day, and then I'll bring this thing home at night. I'll be studying or reading PubMed articles or whatever. And what am I doing? I'm lasering my brain in different parts. Like they've even shown in studies where we did a HRV study on vagal nerve stimulation. So just lasering here. I'm big on electrical stuff, tragus clips and all these kind of things for vagal nerve stimulation. But we did a study showing HRV, or heart rate variability, just lasering right here. Well, if you laser the vagus nerve, you promote acetylcholine and memory stuff. So they've actually shown in studies you're going to recall and retain information better doing vagal nerve stimulation, just as one example. So if I'm studying something and trying to learn it, people see me just sitting here like this as I'm reading. I did this with my daughters too a little bit. And so it's kind of a neat way. You can tap into all kinds of really cool neurological activations with laser as well.
Does the vagus nerve also anxiety?
I love that question, because with anxiety and a lot of the neuropsych things that are going on, they've shown vagal nerve stimulation to be beneficial. Just as the resting, digesting component of this, that whole brain-gut axis is a really interesting and becoming a very important way to rehab the brain. And so if you can get the body into more of a resting, digesting state, because so many of us are in that fight or flight mode all the time, we should be doing stuff actively to get into a resting, digesting state. So yes, vagal nerve stimulation is great for that. Leaky gut is such a big thing with autoimmunity and brain degeneration and whatnot. Well, you want to do vagal nerve stimulation for leaky gut and leaky barrier system, blood, brain, and gut barrier. Well, you can do that directly with lasers on the gut and on the brain, but you can even do it through the other vagal nerve stimulation activation, like by hitting it right along here. So yeah, I think vagal nerve stimulation is a really neat tool to tap into for, again, even just from systemic inflammation and pain management. They've been using vagal nerve stimulation to modulate pain. And this is going to be technical, but where the vagus nerve, the home base sits in the brainstem, that's also where you make serotonin. As one of the things with serotonin is that inhibits pain in the spinal cord level. That's just one example of how we use it for pain management as well.
Also make you happy.
That's a good thing. A happy patient is typically in less pain as well too, and those two feed off of each other, and better sleep even. So there's so many layers to what we're doing with lasers and central nervous system. That's quite exciting. So it was actually. Interestingly, it was in communist Russia. It was in Hungary, back behind the Iron Curtain days at Heidelberg University in 1960s. They actually were doing animal studies where they thought they were going to use red light to cause cancer and other health things. And so they shaved these rats and then they started lasering them. And not only did it not cause cancer and stuff, they found that the rats lived longer, they were healthier, it grew their hair back. So the researchers went, oh, wait a minute, what are we on to here? And so they started doing all this research on red light therapy. In Russia to this day, it's one of the red light and this color, that 635 is exactly what they use for red. That's what a primary treatment form is for Russian healthcare providers. Now, because it was behind the Iron Curtain, we didn't know in Western medicine what was going on. Well, once that Iron Curtain went down, we started seeing the research that they were doing, and now we jumped on, and that became a major treatment modality. So. One of the interesting things that Steve, when they saw what I was doing with laser and brain, because I was always in the field of functional integrative neurology, but then when lasers came along, I started doing some really cool things with brain-based applications. And so Steve, the founder of the company and head of research, he and the team, we got connected through my local Erconia rep, who was a patient of mine as well, and they were interested in me teaching for them. And I said, because I was doing all this brain-based stuff and whatnot, and I said, Steve, I need one thing from you, though. If I'm going to do this, I want you to show me with your basic red, their old red one, it was called the Accelerate. I said, show me a transcranial laser study. Because all the research, I've read thousands of papers on low-level laser therapy, and I knew that Erconia nailed it. A true laser that was low dose, low level, that was in that sweet spot we were talking about, that hormetic sweet spot, the Goldilocks effect, if you will. And I said, Steve, if you can just show me a real-time imaging study with your most basic laser penetrating the skull, I said, that's going to be a mic drop moment. That's the game changer, because you're going to hear detractors say, well, because it's low level, it won't penetrate the skull. And they did. To their credit, they did a real-time functional imaging study showing the laser energy penetrating the skull. And I said, that was it. Because now there's no questions asked. You guys are perfectly situated. You're the perfect true laser company. Because the LED thing gets a lot of airtime, right? And, the LED with skull penetration is very questionable because it is. It's like taking a red light bulb basically and shining it next to somebody's head. Are you going to get some photons? Yeah, you will. But to compare that to true laser, that's collimated, coherent, parallel energy, there's billions and billions of photons every millisecond, and it's about the energy of the photon. That is one of the biggest issues with lasers. Everyone, you hear this power rhetoric, but it's not about the power, it's about the energy. And the shorter the wavelength, the more energy. That's why it has, like, violet is the most energetic color, and that's the green is the next one on the spectrum, then red. These higher powered lasers use longer wavelengths. That's not what gives the energy into it. It's not the power, it's the energy per photon. And there's a big difference between energy and power. And so that's one of the big misconceptions with laser physiology and laser research and whatnot. It's not the power. You don't need a 40 watt, a 60 watt laser. That's complete garbage. It is the energy per photon. And so we like that end of the color spectrum, the violet, and the rainbow, that's the most energetic. The next one up is UV light. And UV light we know is very good for antimicrobial stuff, right? We use it for sterilizing medical instruments. We use it for all that stuff. But the problem is with UV light in excess, it can cause damage to mammalian cells, like a sunburn can cause cancers and things like that. Well, if you're in the visible spectrum with violet light, you get all the benefits of UV light, like antimicrobial, antibacterial, antiviral, that kind of stuff. But it doesn't exceed that causing free radical damage and things like, or cancer causing stuff and things like that. So violet is a really good tool to have because it's very energetic. That's why it does even better in pain studies and other things like that. And it's still safe, but you get all the benefits, kind of less similar to UV light. So we love stacking colors. That's why we're doing, to Erconia's credit, they were the first to come out with the green. So now we're using green, red, and violet on our patients. And it's having even better results than just red did. Yeah.
Does it go through clothes?
Oh, I love that question. Does laser go through clothes? Well, here's the way, because I always use the example, it goes through the skull. So yeah, it can go through clothes. Obviously, anytime you can get it directly on the skin, and not, you're going to get even better absorption. But I've often heard it's like a chain link throwing sand through a chain link fencing analogy. It's like, most of the sand's going to get through the fence. Some of the photons might get blocked or absorbed. The darker the color clothes, the more it absorbs the photon. So again, like if I'm wearing black pants, if I can get directly on the skin, that's great, but you don't have to. It's not like you have to strip the patient naked, or just like when we do the transcranial stuff, it's not like we shaved everyone's head to get rid of the hair and things like that. So yes, it will go through clothes. Yes, we'll do things like that. A good analogy is like, we're absorbing sunlight. That's 93 million miles away or whatever it is. We're absorbing that into our skin, through our, that kind of stuff. Yeah. So, think of it in that context. So yes, it will, but obviously anytime you can get it directly on the skin. And you can be, with true laser, you can be far away. Like a lot of vets that work with, I've talked to people that work with lions and stuff. It's not like they're sitting there with the lion, doing this kind of thing. They're back shooting further away. You can technically go right on the skin, but Erconia has these really cool technologies like scanning diodes and line beam generation and stuff that does a really good job of, you might as well tap into that. So usually it's around 4 to 6 inches away is kind of a common thing. And then, but the other thing, because it's non-thermal, I have no issues using an Erconia on a titanium hip. Or what's that tattoo called in the low back? Thank you. You said it, not me. I get in trouble when I say these kind of things, so I make my audience say it now. So I could not, when we did the chronic low back study, think of how many people have those tramp stamps, right? And you can't use a high-powered laser on that. You're going to burn them. You can't use even a 3B can burn a patient over that, and definitely on a tattoo, class 4. Forget about it. Well, you see these people now, they have the sleeves and a lot of that, trying to use a high-powered laser on that, you're basically just going to burn the patient. Yeah, so... Yeah.
So if you stuck around this long and you'd like to check out the video where Bob first started using this laser treatment and how his walking was doing, you can click the video link on the screen. How is Bob doing and what has helped?
There you go. Good luck with everything. Oh, yes, we're supposed to type on something.
Add comments down below if this video was important to you.
That's right. Please do.